Hi there folks, Michael from First Aid Oz, and in this video we're going to be talking about rice. Okay, not the rice that you eat, okay, but the protocol for the treatment of soft tissue injury. So RICE stands for rest, ice, compression, elevation. So it's used when there is a strain of the muscle or tendon or a sprain of the joint, which is the ligament. So being overstretched, perhaps you roll your ankle or you overstretch trying to pick something up off the floor and you get a bit of a tweak in your hamstring or your lower back, for example. So not a complete rupture, not a complete tear. Those things require a surgical intervention. But in this case, there's a stretching of the fibers and there is often pain associated with it. But the other key thing that's associated with those type of injuries is swelling. Okay, so blood is sent to that area, which is effectively the body's way of trying to create a cushioning or a protective layer around that injury to prevent further injury. But again, swelling has its own issues when it comes to the rate of recovery from that injury, because the more swelling there is, the longer it takes to recover and return to our normal activity, and also the more difficult it is sometimes to make a more accurate diagnosis of what the injury actually is. Because not everything will show up in an ultrasound or an MRI. Sometimes the medicos want to do like a function test, particularly in the case of ligaments, and where there's a lot of swelling, they can't get enough movement, they've got to wait for the swelling to go down. So the primary objective of RICE, the entire protocol, the primary objective is to reduce swelling or slow down swelling or lessen swelling. So if we look at that protocol, so the first step is rest. Okay, now rest means obviously stop what it is that you were doing which caused the injury in the first place. So for example, if I was lifting something and I felt a bit of a twang in my back, okay, and I thought, well, okay, well, I've only got 10 more to do, I'll be fine, the chances of making it progressively worse are greater. Okay, so you need to stop doing whatever you were doing which caused that injury. Obviously, if you're in playing or running or doing something like that and you strain your hamstring, then you stop running. Okay, you don't continue to run, because there is the chance that you can make it worse. It can go from a strain to a partial tear, from a partial tear to a complete rupture. That strain is a warning sign. Okay, so you need to stop, and you also need to stop so that you can start the management treatment straight away. Now understand this, the RICE protocol doesn't fix the injury, it minimises the swelling. Okay, so the injury is still going to take time to heal, or in the case of something more serious, maybe some other medical intervention. As a first aider, we can't give anti-inflammatory drugs or anti-inflammatory substances to try and reduce the swelling. Okay, that's beyond our scope. Okay, the person can choose to do that themselves, and there are some over-the-counter things they can get. Okay, but we can't administer that. Okay, all right. So let's look at it step by step. So rest, we mentioned, stop doing what you're doing, but rest by stop your activity, you're also slowing down your heart rate. So if you're slowing down your heart rate, effectively slowing down the rate of blood distribution or circulation internally, which is going to help slow down the blood being sent to that area, because the faster the circulation, the more blood will get there quickly. So again, we want to slow that down. But the primary thing with rest is to stop doing whatever it was that caused that injury. Okay, and the second part of the acronym is ICE. Now there's a few different variations. I'll just put my bandage over here. A few different variations when it comes to ICE. So this example is an ICE gel pack, if you like. The benefit of these is they're quite cheap. But the disadvantage is that they don't stay frozen very long. So you would need multiple packs in your freezer. Okay, this one's not frozen, which is why it bends, but just to show you. You can also use an ice pack, where you twist and break the crystals, and the crystals create a cold. Those are instant ice packs and one use only, so after they've been used, you need to discard them. The important thing with those ice packs, however, is you need to make sure you replace them. So don't have only one, you should have more than one, because as soon as you've used one and you throw it out, okay, there may be some time before you go and buy another one. and sure enough, the day you need one, you'll be looking for where that ice pack is. So always have more than one. Always have a spare or more than one spare. If you're in an environment where ice packs get used quite often, then have several. Okay, they're not overly expensive. Another option, particularly for at home, some people don't want to have ice packs lying around, is to have a bag of frozen peas. Now, not dissimilar to when you buy a bag of ice from a service station, you might, bang it down on your kitchen counter a couple of times first, just to loosen up the peas. Don't open the packet, just so that it can mold around the injury, and then we wrap it into place. Important though, if you're using frozen peas from your freezer, that you get a big fat magic marker and you write on it ice pack only, because you can reuse that countless number of times. What you don't want to do with those peas is eat them, okay? Because if they've been frozen and then defrosted and frozen and then defrosted, that's not going to be a very pleasant spoonful of peas when you eat it, and there is a risk of poisoning to yourself as well. So make sure it's clearly designated that it's for the ice pack purposes. Anyway, so any of those things can be used as an ice pack. There are cold sprays and ice sprays you can get, which can give some short-term relief, not as effective as ice. You can get crushed ice, or you can get ice cubes and put them in plastic bags and make your own. Any of those things will work, and all those things are handy. Effectively, what we're trying to do is we're trying to administer cold to the area. What cold does, okay, in terms of bleeding and swelling, is cold constricts the blood vessels, okay? So by constricting the blood vessels, it makes it more difficult for the blood to flow, slows down the blood flow to the area. So we ice the injured area. We're trying to make it harder for blood to get to that area. The other thing that ice does, which is a bit of a bonus, is once you've had it on for a period of time, it can make the area numb, okay, which can help with temporary pain relief. Okay, if the area is numb, sometimes it doesn't hurt as much. Okay, however, understand that's only temporary. That will wear off when you take the ice off. So we generally put the ice on for 20 minutes, take it off for 20 to 30 minutes, and we can repeat that as often as we want, as often as is practical, because obviously depending on time of day and all those sort of things, for the first 2 to 3 days even. Okay, the ice will be effective in reducing that swelling. Of course, if we're able to get medical attention sooner than that, that's better. So don't wait 3 days. You might think it's something relatively minor, okay, so you'll be fine, okay, but if the pain persists, or if its pain's quite severe, I would get that medical checkup as quickly as possible. Okay, so 20 minutes on, 20 minutes off, or if you find it unbearable to have the ice on for that period of time, even 10 minutes on is fine. 20 minutes off, 10 minutes on, and so on. Okay, again, better than nothing. All right, important thing though when you're applying ice, okay, is that you would get a tea towel, okay, and you would wet it. Wet it with cold water, okay, don't wet it with warm water. Again, it's going to be counterproductive. I take the ice pack into my wet tea towel and I wrap it, okay, and that is to assist. So let's say that I've sprained my knee, cold wet ice pack, cold wet tea towel around my ice pack, and that helps keep the ice colder longer. Okay, in the case of, like I said, the gel packs, when I take it off and 20 minutes later put another one on, I take another one that's frozen and put it on. I put this one back in the freezer. Okay, so damp tea towel, cold water around the ice pack, that helps protect from any burn from the ice or any discomfort from the ice on the skin. And you want the ice to be on the skin where possible, okay? If you don't have a tea towel, or if the person has a layer of clothing, yes, you can ice over the layer of clothing. If they've rolled their ankle and they've got their shoe on, you don't even have to take the shoe off, okay? You leave the shoe on and you just ice around that ankle, okay? Because the next stage is compression. Now, compression is important. So I mentioned in the case of the ankle where you've got the shoe, the shoe actually helps with compression because it helps prevent the ankle from swelling. In terms of compression, so I would apply a bandage, in this case an elastic bandage, okay? Because if the bandage is not elastic, it's very hard to compress. A lot of people think the bandaging is just to keep the ice pack in place. Now obviously that's one part of it, okay? But the elastic bandage, you want to actually have some pressure on the ice pack, and I'll just do this as I talk, to not only keep the ice pack in place, but actually firm the area to stop or help make it more difficult for the area to swell, to hold its shape. So imagine, you know, I put this on and I continued and I wrapped around until I ran out of bandage and I just tucked the bandage underneath. So I've got rest, I've got the ice, I've got the compression, but you notice I put my foot up on the chair, and that was not only so you could see, but also elevation of the limb. Ideally, okay, elevation higher than the level of the heart, but obviously I'm sitting in a chair. So in this case, I would most likely lay on the floor and put my foot up on the seat of the chair so that my injured area is higher than the level of my heart. Not very photogenic if I do that now for the purpose of the video, so I'll just stay sitting here, but to show that we elevate the limb. Now if it's my arm, again, sit on the floor, put my arm on the back of the chair. And most of the time it will be arm or leg, more often than not, okay? So rest, ice, compression, elevation, all of those things conspire together to try and minimize swelling. Remember, it doesn't fix the injury. I still need to take this to a medical practitioner to make sure that there's nothing more serious than I think. Sprain joint can take a long time to heal because the ligaments don't have a blood flow, so there's no natural healing properties. So they do take a long time to heal. You'll often get bruising associated as well. If in doubt, okay, make sure you get it looked at, because again, it could be something more serious. If it's a strain to muscle or tendon, again, can take a while to heal. The muscle tends to heal faster as long as there's no tear or rupture, because muscle cells have blood flow. Tendons take a little bit longer to heal because they don't have such a good blood flow. After 72 hours, you can start to apply things like heat. It's important that you don't apply heat in that first couple of days, because heat actually increases bleeding to the area. So heat will increase the swelling, okay? And that also includes something like alcohol, because alcohol dilates the blood vessels, opens up the blood vessels. So not only alcohol that you drink, of course, but also alcohol rubs that you can get that you rub onto areas, which do provide relief, but use them after that 72 hours, okay? So heat rubs and those type of things, which can be helpful. Heat packs, you know, those ones you put in the microwave and place on top, or infrared lamps, all those type of things. Massage as well, okay? Massage too early can increase the bleeding. So again, after 72 hours, particularly in the case of muscle strain, massage can help reintroduce blood flow to help with the healing of that area, okay? But not in the first couple of days. We want to prevent doing anything which is going to increase the swelling. It's counterproductive to what we're trying to do with this R.I.C.E treatment. Okay, so that's it for R.I.C.E. I hope you didn't get too hungry, but that's our protocol for soft tissue injury. Thank you.